Question number 1. Maximum contribution to the floor of orbit is by. Options are A. Maxilla, B. Zygomatic, C. Sphenoid, and D. Palatine. So here you can see the answer is A. Maxilla. In this diagram you can see this one is the maxillary bone and this is the orbital contribution of the maxilla. Now the next question is question number 2. All are true about femoral triangle except options are A. Lateral margin is formed by sartorius muscle, B. Floor is formed by adductor longus, C. Contains the femoral vessels, and D. None of the above. So here in this diagram you can see this one is the femoral triangle and this lateral boundary it is made up of the sartorius muscle and this adductor longus muscle it forms the floor of the femoral triangle. These all are the contents: femoral artery, femoral vein and femoral nerve. So here the correct answer is D, none of the above. Now the next question, question number 3, which is a typical intercostal nerve? Options are A. First, B. Second, C. Third, and D. Seventh intercostal nerve. So intercostal nerves third, fourth, fifth, and sixth. These are the typical intercostal nerve here. So here the correct answer is C. Third nerve. Question number 4. Trendelenburg test is positive due to injury to which of the following nerve? Options are A. Obturator nerve, B. Sciatic nerve, C. Superior gluteal nerve, and D. Inferior gluteal nerve. So here in this diagram you can see these are the gluteus medius and gluteus minimus muscle and these muscles are supplied by superior gluteal nerve. So on paralysis of this muscle they give the Trendelenburg test positive. So here the correct answer is C. Superior gluteal nerve. Now the next question, question number 5. Lateral boundary of cubital fossa is formed by. Options are A. Brachioradialis, B. Pronator teres muscle, C. Brachialis muscle, and D. Biceps brachii muscle. So lateral boundary of cubital fossa. So here you can see this is cubital fossa. So lateral boundary is made up of brachioradialis, medial boundary is made up of pronator teres muscle. So the correct answer is A. Brachioradialis muscle. Now the question number 6. All of the following are structures associated with pterygopalatine fossa except. Options are A. Pterygopalatine ganglion, B. Mid-third of maxillary artery, C. Maxillary nerve, and D. Greater petrosal nerve. So here you can see this is the pterygopalatine fossa. So all these are the contents of pterygopalatine fossa except the mid-third of maxillary artery here. So the correct answer is mid-third of maxillary artery. Question number 7. Which of the following is not a branch of first part of maxillary artery? Options are A. Middle meningeal artery, B. Accessory meningeal artery, C. Inferior alveolar artery, and D. Greater palatine artery. So here you can remember the branches of first part of maxillary artery by the mnemonic MAIDA, M-A-I-D-A. M stands for the middle meningeal artery, A means accessory meningeal artery, E inferior alveolar artery, deep auricular artery, and A anterior tympanic artery. So here the correct answer is D. Greater palatine artery. It is not a branch of the first part of maxillary artery. Then 8. Ophthalmic artery is a branch of. किसकी branch है ophthalmic artery? A. Cavernous part of internal carotid artery, B. Cerebral part of internal carotid artery, C. Middle cerebral artery, and D is the facial artery. So ophthalmic artery it is a branch of this cerebral part of internal carotid artery. Now the next question, question number 9. Postganglionic fibers to parotid gland is supplied by. Options are A. Glossopharyngeal nerve, B. Auriculotemporal nerve, C. Both of the above, and D. None of the above. So here you can see parotid gland, the secretomotor fibers to the parotid gland, that is via otic ganglion. So glossopharyngeal nerve it gives the preganglionic fibers and postganglionic fibers, that is via auriculotemporal nerve. So here the correct answer is B. Auriculotemporal nerve. Now the next question, question number 10. Sensory supply to tongue is by all except. Options are A. Lingual nerve, B. Vagus nerve, C. Glossopharyngeal nerve, and D. None of the above. So sensory supply to the tongue. So anterior two-third of the tongue sensory supply, that is via chorda tympani and lingual nerve. Then posterior one-third, that is via the glossopharyngeal nerve, and the most posterior portion, that is via the internal laryngeal nerve, which is the branch of vagus nerve. So here the correct answer is D. None of the above.